Hi again. Let's go over the vascular system for head neck anatomy. So, just to point out the distribution of blood, some of this is probably going to be reviewed from A&P, but I think it's worthwhile going over quickly again. Note that most of the blood in the body is in the venous side of the system. Approximately 64, about 2/3, 64%, 2/3 of the blood is in the veins. Systemic arteries, by contrast, over here, about 13%. So most of the blood's in the veins. Okay. And we're going to be going from the heart to the head first, and then we'll do the drainage second. Just review again, start with a picture of the heart. Should be familiar. You have, right ventricle, left ventricle, superior vena cava, the aortic arch that we'll be looking at, and then 3 branches off of that we'll cover. So next slide, more detail. I would like you to be able to trace a drop of blood through the heart like you did in A&P. Start with it returning from the head, go through the heart, chambers, valves to the lungs, and back up to the head. That would be great. So let's just run through this real quick. Blue is oxygen poor, red is oxygen rich. Don't think in terms of blue and red as veins and arteries. Think of it in terms of oxygen level. So just to start out, coming back from the head, we have the superior vena cava. There's also an inferior vena cava, which you can abbreviate IVC and SVC if you like. And that blood comes back, it's oxygen poor, comes back in through the superior vena cava. We'll do the trunks later. Those are brachiocephalic trunks. And blood goes into the right atrium. And from there it goes through the first valve, which is the tricuspid valve, or the right atrioventricular valve, goes into the right ventricle, gets pumped out when the ventricles contract, out through the second valve, which is the pulmonary or the pulmonic valve, and this is going out the pulmonary trunk, and these are going out to the pulmonary arteries, right and left. And those are going to the lungs. Goes to the lungs, exchange gases, gets rid of CO2, picks up oxygen, comes back from the lungs, and we come back through the pulmonary veins. Veins are returning blood to the heart. Arteries are taking blood away from the heart. So these are pulmonary veins, and they are returning from the lungs. And that blood then goes into the left atrium. And it's coming in from the other side also. And from the left atrium, it then goes into the left ventricle through the third valve, which is the mitral valve, into the left ventricle, gets pumped out through the aortic valve, which is the last valve. And then when it goes out to the aortic valve, it goes into the arch. And then we have our 3 branches that we'll go over. So that's pretty straightforward, pretty much review. So again, just in the spirit of review, some real basic concepts that you should still remember. So we'll just zip through these real quick. Remember that both atria contract together, and they contract first. So they're on the top. Second contraction are both ventricles together. So the heart does not contract left side, right side. It contracts top, bottom, top, bottom, top, bottom. And the heart sounds that you hear with auscultation using a stethoscope, the lub-dub, the two sounds, S1 and S2 for the first heart sound and the second heart sound. The lub is the sound of the AV valves closing. So when the heart contracts, the AV valves snap shut, and that creates turbulence in the blood, and you hear that as the lub sound. And when the AV valves close, of course, it prevents blood from blowing back into the atria. We don't want it to go backwards. The second sound, the dub, is the sound of the semilunar valves closing, the pulmonic and the aortic valve. So that when the heart relaxes, those valves snap shut, creating turbulence that you hear, and that prevents blood from flowing back down through the aorta or the pulmonary trunk back into the left ventricle. We want it to keep going in one direction. So it's the sound of the valves closing. AV valves first, semilunar valves second, and then it goes into rest. And systolic pressure is the maximum pressure that's in the vascular system when the heart is in systole, when it contracts and it pushes the blood out of the ventricles. That is the systolic pressure. And that is palpable as a radial pulse out on the wrist. So when you put your fingers on somebody's wrist and you're taking the radial pulse, you're feeling that systolic pressure wave. Okay, the diastolic pressure is the pressure in the vascular system when the heart is at rest, right before it contracts again. So it's the lowest pressure in the system closest to the heart. And typical textbook blood pressure, 120/80. And the units are millimeters of mercury. So, enough of that. And we will be starting, going to the head. We will start in the aorta, and then we're going to be looking at these vessels and naming those first. So, here are some notes where students often sort of trip and make some mistakes. So, there are carotid arteries only. There are no carotid veins. So make a flashcard, get that down. If we're talking about carotids, we're talking about carotid arteries. And that will divide, which we'll get to. When we're talking about jugular, we're talking about veins, jugular veins. So there are no jugular arteries. So it's carotid arteries and jugular veins. Brachial refers to the arm. And cephalic refers to the head. So if we combine those two terms with our little O for a connector, we have the arm and the head. So if we have a brachiocephalic artery, we're going to be going to the arm and to the head. If we have a brachiocephalic vein, we're coming back from the arm and back from the head together. Okay, we'll see both of those. So let's start with the carotid arteries. And their supply, they're arterial, carrying arterial blood toward the head. Common in a name, particularly with arteries, means that it's going to branch. So if we have a common carotid artery, we know that it's going to branch, and it's going to branch into the internal carotid and the external carotid. So we do not have an internal common carotid. So you have to get your names straight. And we'll draw this and go over it. The internal carotid artery has no branches until it gets inside the head. So when it splits off from the common carotid, the internal goes straight into the head before it branches and does anything, and it supplies the cerebral arterial circle, or this circle of Willis. We'll take a quick look at that. The external carotid has many branches and supplies the face and head tissues, everything but the brain. So that's where we will spend most of our time, is studying branches of the external carotid artery. Okay. So forget about the bottom half of the slide for the time being. That's dealing with drainage. We're dealing with supply first. We'll do the arteries, and then we'll come back later when we're done with the arteries, and we'll drain the blood out of the head through the veins. So this is just a basic supply or route that we've kind of gone over. The ascending aorta, the arch. Then we have the brachiocephalic, right subclavian, left common carotid, internal and external carotid. So we'll go through all that. Okay, so here's the arch. And we have 3 branches. 1, 2, and 3. So just to start out, these are going to the arms. These aren't labeled in this figure, and this is going off to the head. So these are the right and left common carotid arteries. They're not labeled. So this would be the left common carotid artery. And the right would be the same. And then we have an internal carotid, and that's going to supply the brain. And then we have an external carotid, which is going to supply the face and everything else. These 3 branches, let me see if I had another slide here. Let's go to the next one here. Okay, because this slide's getting kind of busy and I'll just mark it all up. So here's the arch, and the 3 branches that we have. We have 1, 2, and 3. So we're going to go to the next slide, which is sort of a line drawing that I made, and we'll label these. Okay, so there's our heart coming out of the left side. High pressure side, and again here is the arch, and these are our 3 branches pointing at. So let's go ahead and label these. So this first branch is the brachiocephalic. It's called a brachiocephalic artery. Sometimes it's referred to as a brachiocephalic trunk. And that is this first one right there. That's our first branch coming off of the arch. The second branch is the left common carotid artery. And where would the right common carotid artery be? It's this one right here. Right common. Carotid artery. And let's do these. So we have a left subclavian, artery. Oops, I forgot the L for left. And this would be our right subclavian artery. It's good to put in right or left. Right subclavian artery. There. Okay? So, if you had to list the 3 branches in order coming off of the arch, 1, 2, and 3, your first one would be the brachiocephalic. Your second one would be the left common carotid, and the third one would be the left subclavian. Okay, so let's split the common carotids into the internal and the external. So let's make these the right and left internal carotid arteries. Arts. Remember, they're going to the brain. And that leaves these as the external. So this would be the left external carotid artery. And this, of course, would be the right external carotid artery. It's good to practice these. Students sometimes get them all jumbled up and they start putting common back into the external or the internal, and it's a bit of a mess. So practice that. You can whip up little drawings like that on your own quickly. They take no time to make up. You can just do a little heart, and there's your arch. Go to the arms, go to the head, and just label them. And then you can divide the common carotids, and voila, it's good practice. Okay, let's move on. And I want to take blood up to the brain. So we're going to go through the circle of Willis, and then we'll end this lecture. So we are taking blood to the brain, which will be through the internal carotid artery. So just to get ourselves started, the labels are small in this, but here is our common carotid. I'm going to abbreviate and get a smaller pen. And then it divides. So that would be our external, which we're not looking at right now because we're going to the brain. So this is our internal carotid. You remember the bony passage entering the skull through the carotid canal, and then it enters the cranium and it forms a little ring road going around, sort of forming our circle of Willis, which we'll look at in another picture. So the internal carotid artery is a major supplier of blood to the brain, as is the vertebral arteries, or the vertebral arteries, depending on how you want to pronounce it. And they are down here. And they branch off of the subclavian. They run through the transverse processes of the cervical vertebrae. And then the right and the left vertebral arteries merge. And then they form this trunk, and they also supply the yellow circle of Willis. So the two main supply blood vessels to the brain are the internal carotids and the vertebral arteries. Okay, the next slide is a schematic. So you should be able to figure out everything on the left once we go through it. So again, here's the arch. Here's your first branch, second branch, third branch. You know what those are named. And here is the left subclavian. And here is the left vertebral. So the vertebral arteries, both right and left, come off of the subclavian. Okay, so we just follow those all the way up, the right and the left vertebral arteries, and they then merge here, and they fuse into this basilar artery. Okay, so you also have the right and left common carotids. So this would be the left, I'll abbreviate again, common carotid. And if this is the internal, that would mean this has to be the external carotid artery. These are all labeled except for some of these that are cut. Okay, so here is the internal. They're both running up on both the right and the left, and then they enter this little loop-de-loop through that carotid canal, and then they form this ring. And this is the circle of Willis. And you have the vertebral arteries and the basilar arteries supplying blood, and you have the internal carotids supplying blood as well. That pressurizes the circle. On the right side is an enlargement in color of that circle of Willis. So you should be able to identify the arteries and the branches from the other figure. So they're the same. You get the idea with the arrow. Now the idea is that you're supplying the brain. The cerebrum is the largest portion of the brain. So the pituitary gland this is the base of the brain. So the pituitary gland is sitting right in this little pit. So this would be in the circle. So this would be the pituitary gland. Just to get you kind of oriented. This is right lying on the base of the sella turcica, and the pituitary is sitting right in there. And you pressurize this circle, and so here's the circle again. And you get that circle pressurized, and then you can take off these, and you supply the cerebrum. So the three sets are, if you go back to the left side, there is the anterior cerebral arteries. There are the middle cerebral arteries. And there are the posterior cerebral arteries. That's pretty easy. Anterior, middle, and posterior. So back on the right, these would be our anterior cerebral arteries. Getting the frontal lobe of the cerebrum. And we have the middle cerebral arteries, both sides. And then we have the posterior. Cerebral arteries. So you can figure out what these blood vessels would be that merge so here's the basilar artery again. So these would be the vertebral arteries. And that's our circle of Willis. And we're done with that. We won't do any more. So we have it up to the brain through the internal carotid, and then we will spend most of our time on the external. So there's more practice. Oh, a couple of things that I didn't draw on the other view. Let's do it over here anyway. You can print out more pages of this if you want. It's in the slide set. These are the ophthalmic arteries. So they're going to the eye. So they come off of the circle, and then we have this anterior communicating that connects the two anterior cerebral arteries. So this is our anterior communicating. And then we have two, a right and a left posterior communicating. And then there are a number of cerebellar branches that I don't care about, so you can ignore those. Okay, so I believe that's it for this lecture. And next we will start looking at branches of the external carotid, but that'll be the next lecture. So, ask questions if you have them, practice this, and you should do fine. See you soon. Bye.